Joint disease can be inflammatory versus non-inflammatory, and we can differentiate very easily, at least in theory. Uh, it's difficult to look inside the synovial capsule, but at least in theory we know that there is no uh, synovial membrane inflammation, so it's non-inflammatory. If there are no systemic signs and symptoms, non-inflammatory, and synovial fluid analysis will come back normal. So inflammatory, it's more systemic, while non-inflammatory is more localized. Osteoarthritis is one of the degenerative joint diseases, and diseases of the joints, as diseases of the bone, result in severe immobility, and the incidence of them may increase with age. Patient will require use of assistive devices, and quality of life will be impaired, and eventually patient may require assistance or placed into a skilled nursing facility. When osteoarthritis happens, it's inflammation of the joint that may result in the loss of articular cartilage, and also formation of the bone spurs. At some point, every person probably had arthritis, and by arthritis we can have any sprained joint or jammed finger or anything, any inflammation or dislocated joint certainly will result in arthritis, because arthritis is nothing but joint inflammation. However, osteoarthritis or degenerative joint disease, it's a process of wear and tear or wearing out of the joint, and most of the people actually has some degree of osteoarthritis, and the wear and tear of the joints starts in early adulthood and continues with age. The etiology is unknown. It's so-called primary disease, which is really idiopathic, which we can say that disease can have multifactorial character, but again, this is a wear and tear disease, and for instance, having sports injuries will increase the incidence or onset of the disease. With osteoarthritis, the local areas of damage will occur, and loss of cartilage will happen. New bone will start forming at the joint margin. Its subchondrial bone changes will happen, and patient will start developing mild synovitis and the thickening of joint capsule. So patient will have muscle pain, pressure in subchondrial bone will increase, the capsule stretching causing bone, and the ligaments will be straining and tendons will be straining, and the periosteum will be elevated. So patient will have pain, stiffness, enlargement of the joint, tenderness to touch, mobility issues, and deformity. Sometimes you will see severe osteoarthritis in the knee, and size of knee significantly increased, but again, this is just idiopathic disease. Inflammatory joint disease, again commonly called arthritis, is somewhat different from osteoarthritis. It's just that inflammatory damage in destruction of synovial membrane and cartilage or articular cartilage, and has some systemic signs of inflammation. At this time, when patient will be experiencing fever, elevated white blood cell count, malaise, loss of appetite, and this can be infectious or non-infectious in origin. So if there is some type of inflammation of joint occurs with systemic changes, so this may be just inflammatory damage secondary to infection. But again, patient will have the symptoms of osteoarthritis, but at this point the disease isn't idiopathic and we can pinpoint the causative agent or the source of the symptoms. Rheumatoid arthritis is a separate disorder, and it's a inflammatory joint disease. It's a systemic autoimmune disease and autoimmune attack to self-connective tissues, and the attack occurs on the synovial membranes. So patients will have most of the symptoms similar to osteoarthritis, but there are some differences. The difference between osteoarthritis and rheumatoid arthritis is how the joints are affected in the hands. Osteoarthritis, and that's kind of like rule of thumb, is affecting the working joints in the hands, and by working joints in the hand I mean like primary and distal and proximal intraphalangeal joint, and it will cause swelling and pain. At the same time, all joints in the hand can be affected in rheumatoid arthritis. The patient with rheumatoid arthritis will have significant deformity, and the patient will have ulnar deviation, which is a characteristic sign for the rheumatoid arthritis. In osteoarthritis, usually the small bones aren't affected that much, and osteoarthritis is a big joint disease such as knees. So lab results, lab tests will be revealing for rheumatoid factors presence, and also antibodies, IgG and IgM, will be present. When synovial fluid is aspirated, it will be significant for the presence of inflammatory exudate. But again, the rule of thumb or the rule is if small joints affected, it's most likely rheumatoid arthritis, big joints, osteoarthritis. Symmetrical involvement, both hands, rheumatoid arthritis. Asymmetric, one knee, it's osteoarthritis. So symmetrical, rheumatoid. Asymmetric, osteo. Historical evaluation for rheumatoid arthritis. So this is a list which you can actually diagnose with, and 4 of these should be present. Morning joint stiffness that will last at least 1 hour, arthritis in 3 or more joint areas, and arthritis in the hand joints, symmetric arthritis, rheumatoid nodules, and rheumatoid nodules is subcutaneous nodules that present in the patient with rheumatoid arthritis, elevation of rheumatoid factor in the blood test, and again X-ray changes such as ulnar deviation or ulnar drift. So patient's hands will be moving towards the ulnar bone, so their pinkies will be sticking out somewhat. So these are if four of these present, that's diagnostically relevant to diagnose with rheumatoid arthritis. But again, RF is a significant finding to diagnose someone with rheumatoid arthritis versus something like arthritis of the joints in the hands, or arthritis in the 3 or more joint areas. So these are not so specific, but RF will be more specific. Ankylosing spondylitis, it's an inflammatory joint disease that can cause stiffening and the fusion of the joints. Again, it's systemic and autoimmune character inflammatory disease. So what happens in this case, inflammation in the spine or sacroiliac joints will be causing stiffening and fusion of the joint. So primary sites will be sites where ligaments, tendons, and the joint capsules are inserted into the bone, and the site calls entasis. So the primary site is always considered that the entasis is the primary site with this disease. Truly, there is no known cause, no certain cause for this, but there is association with HLA B27 antigen, but again, this is one of the diseases that the symptomatology and diagnostic evaluation is quite developed, but etiology is still not so well known. Patient in this situation, in this condition, will be having inflammation of fibrocartilage in vertebral and sacroiliac joints, and when this happens, inflammatory cells will start infiltrating and they will destroy or erode fibrocartilage, and of course with the destruction we will attempt to repair this. With repair, unfortunately, we will have scar tissue formation, and scar tissue will ossify and calcify, and joints eventually fuse. So again, these are the best efforts to repair and protect, but however, what happens because of the ossification of the scar tissue, this will cause joint fusion. So again, autoimmune inflammation of fibrocartilage and in vertebral and sacroiliac joint, and eroding fibrocartilage is trying to heal, but it leads to ossification and calcification. So patient will have early symptoms of low back pain, stiffness, pain, decreased mobility, and also you will see that lumbar curvature is lost. Patient will have somewhat flat back because of the fusion.